All right, let's talk about our stress disorders. PTSD is the biggie here, the one that usually gets mentioned and talked about in everyday speech. But you have a related disorder called acute stress disorder that is very similar in its presentation to PTSD. It's usually just shorter term, right? So for acute stress disorder, you need to have symptoms within just a few weeks of the initial event, and those symptoms need to last for less than a month. Now, in contrast, PTSD while you can get symptoms showing up shortly after the event, sometimes they don't show up for months or years afterwards. Um, and about 80% of all cases of acute stress disorder actually turn into PTSD because the symptoms just don't go away after a month, right? Now, you may look at acute stress disorder and you'll be like, I've had that. I've got that right now. Thank you very much. Um, eh. While certainly plenty of us have had events in our life that could trigger acute stress disorder, the question is, with this disorder, as with most, are the symptoms severe enough to cause distress and dysfunction in your life? Are you unable to get your usual activities done? Are you having a hard time maintaining your relationships? Are you having a hard time getting out of bed? Um, this is when these symptoms start moving into the disorder realm, right? Instead of just, hey, I had something really bad happen and I'm kind of struggling with it, but I'm pushing on through, and a few weeks later it's like, well, I got over it, right? This is sort of the next level up from that, where it's not only am I having a hard time with it, but I really can't handle my life and I'm dropping the ball on all of my classes, and I'm skipping shifts at work, and I don't know if I'm making rent this month, and etc. You get the idea. It's a little bit more serious than just, whoa, I'm really having a hard time right now, right? Okay. So aside from the duration of symptoms and when the onset is, the symptoms are very similar between acute stress disorder and PTSD. And generally speaking, these symptoms are increased levels of physical arousal, right? So people get super ramped up. They have high levels of anxiety and guilt. Again, one of the reasons why previously these were classified as anxiety disorders. Um, Folks with these disorders will frequently re-experience the traumatic event, so they will flash back to it, and this can be as simple as just remembering the event, thinking back through it, and getting the same sort of physical response as when it first occurred, or even sometimes more strongly. You get avoidance behaviors because this is super unpleasant, right? Having that level of arousal is not fun. Nobody likes it. And so you try to avoid thinking about whatever it was that happened or doing anything that might trigger those thoughts or those responses. And then frequently you'll get issues of emotional withdrawal and dissociation, meaning pulling away from the self or from relationships. We'll talk about each of those in sort of a little bit more depth, right? Okay, so diagnostic criteria here. The person needs to be exposed to some traumatic event. Now, that can actually be a broader range of things than you might expect. When we think of PTSD, we usually either think of war trauma or of sexual assault. And both of those can and frequently do cause these stress disorders, but it can be broader than that. I have a friend, for instance, who was diagnosed at a very young age, I think 25, with a pretty deadly kind of cancer. And he went through treatment, he recovered, but then had to go to therapy for a couple of years afterwards to deal with the trauma of being diagnosed and going through heavy doses of chemo. And he was experiencing all of the symptoms of, re-experiencing the event, having high levels of stress and withdrawing from his relationships, and had to deal with that, right? So went to therapy, got some meds, and was able to pull through it. Um, so yeah, it can it there you can go through an event where you may look at somebody else and go, "You got PTSD from that? Really? Cancer diagnosis or whatever the case may be." Um, it's worth remembering that not everyone who experiences a traumatic event gets PTSD. And what is traumatic to one person may hold a different level of trauma for a different person, right? So you get two people going through the same event. One of them may feel that event more heavily than the other, may be more reactive to that stress, may develop PTSD. The other one may not. So there's more to it than just the exposure to the event, but that is sort of the principal first thing on the checklist to, hey, did something bad happen to you, right? And then the person has to have at least one of these things that are listed down here at the bottom, where they have distressing memories that they can't control, and or they have traumatic dreams that are repeated, or flashbacks, or experience significant levels of arousal and distress when exposed to trauma-linked stimuli. So, for instance, my grandpa was in World War II and would never talk to anybody about it. He was in the Pacific Theater, saw some hand-to-hand fighting. Things were pretty rough, but we never knew what happened because he would never talk about it. What I did know was that he would never come outside with us on the 4th of July when we were setting off firecrackers, because the sounds were too similar to gunfire and they would make him really stressed out. Even to the very end of his life, he would just avoid that completely. He didn't like to gas up his own car because the smell of gasoline was too linked to his experiences. And so when he smelled it, it would give him bad memories and he would start to stress out, right? And that again is pronounced physical reactions, heavy sweating, racing heart, inappropriate aggressiveness, things like that can all be symptoms of PTSD. Above and beyond that, continuing that list, the person avoids stimuli that are linked to the trauma. Like I said with my grandpa, he just avoided all, firecracker celebrations. He didn't want to have anything to do with it. Having very negative moods in response to thoughts of the trauma. Where just thinking about what happened sends you into a depressive mood, or makes you very angry, or makes you withdraw from others. Hypervigilance, that's this next one. Conspicuous changes in arousal or reactivity. So somebody who the door slams behind them and they jump up out of their chair, fists balled, ready to fight, right? That's, there's any stimulus that causes physiological arousal, causes way too much physiological arousal, that hypervigilance. I have to respond to anything that is similar to my trauma in order to not be traumatized again. And last but certainly not least, the person needs to be experiencing distress or impairment. For PTSD, that needs to last more than a month, right? If it's less than a month, then you're dealing with acute stress disorder. This can happen at any age, from very, very young, even in infancy, all the way through the end of life. You've got 3.5% of people diagnosable with PTSD in any given year in the United States, and is more common amongst women, twice as common amongst women compared to men, and also more common in folks living in poverty with low income. About 2/3 of folks actually do seek treatment, and generally there is some recognizable event attached to this disorder where I know this thing happened to me and I remember it and I know what's bothering me, right? You can have PTSD linked within repressed memories. That's much less common and usually is associated with another set of comorbid disorders. But usually with PTSD, folks know what's bugging them, right? because they're thinking about it all the time. They're having dreams about it. They're reliving the experience. And those experiences can be any and all of the above, right? Doesn't have to even be anything like that happened to you personally. There were plenty of folks. There was a rash of new cases of PTSD after 9/11 in New York, after Hurricane Katrina in New Orleans. Wow, had to think about that for a sec. So yeah, these can be global disasters. They can, or it can be something that just happened to you, right? Um, the sexual assault and rape, not to get put too fine a point on it, but that is the primary reason why women are more likely to receive this diagnosis than men, because they're much, much more likely to be victims of sexual assault than men are. Um, and yeah, there's a whole lot I could say about that. Yeah. Anyway, now there are individual differences that help us understand why some people develop PTSD and some people don't. Okay, so we'll look at each of these in turn, starting with biological factors and go through the others. We talked in the last video about the stress response in the body, right? The hypothalamus triggers the pituitary, which triggers the adrenals to release epinephrine, norepinephrine. Your body is responding to some stressful thing that occurred. Turns out that people differ in the height or the strength of their stress responses. Some people are more sensitive to stress than others are and have more extreme stress responses, more that are more likely to be painful, unpleasant, that are going to cause problems, right? Um, repeated activations of the stress circuit in the brain can lead to overactivation of that circuit, where that then gets triggered more easily and becomes generalized, where other similar kinds of signals or stimuli trigger that stress response. And that may be genetic in nature, right? There may be some folks who just are born with those genetic predispositions to high levels of stress. So my youngest daughter, for instance, to the best of my knowledge, does not have PTSD. However, does have a more heightened stress response than any of my other children. Things go wrong and she immediately just sort of snaps, right? She's the one who breaks things, who, our piano has several keys that don't work because of her. There are a couple of holes in the walls that still need to be fixed, things like that. She's only 11, so I'm hoping she's already grown out of it some. However, right from day one, she was more reactive to stress. We think this is likely because my wife had some health difficulties when she was pregnant with my youngest daughter. And certainly her birth was a very difficult birth. She was born with a cord wrapped around her neck 3 times and didn't breathe for the first couple of minutes after she was born. We thought we had a dead baby on our hands. It was really scary. Nevertheless, that immediate triggering of high levels of stress to say, I can't breathe, I need to be breathing. And then, she did finally breathe and she got past it and she recovered. But it's quite likely that experience triggered predispositions in her genetic code towards higher stress reactivity. And ever since, she's just been the one that snaps the most easily when it comes to stressful responses and stressful situations. That then feeds into childhood experiences, right? Now, my daughter hasn't been abused, to the best of my knowledge. I try to treat her really good. So does my wife. But certainly issues of abuse and neglect will trigger those same pathways. Living in poverty, you may not necessarily think of that as a traumatic stressor, right? But it's worth thinking about where poverty is what we call a stress multiplier. Any stressor that you experience when you are in poverty is going to be harder to deal with because you have fewer resources to confront that stressor with. And I'm not just talking about money, I am also talking about energy and time, right? Because you are more likely to be in a situation where there's not enough food going around. Their mom and dad are working 2 or 3 jobs if both of them are around, and so they have less time to give to you throughout your childhood, and so you have to deal with things on your own, and that you're responsible for yourself in a way that children who live in safe homes and wealthier homes simply don't have to deal with. And so this triggers stronger stress responses pretty much across the board in folks in low-income situations. And you can see catastrophes or the presence of other people with psychological disorders can be pretty traumatic to deal with, especially in very young childhood. We have different styles of thinking about things, different cognitive styles. So, how much do you ruminate on your problems? How much do you roll them over and over and over and over again in your mind and dwell on them? That tends to be linked with high levels of stress, and those folks tend to be a little bit more likely to develop PTSD. Having a worldview where you think everybody's out to get you versus believing that people are generally kind. Now, it's easy to say, well, just think differently. But a lot of this stuff is set really early on, and it's hard to really get a hold of to change your mind about some of these things because you learn it very young. Going together with this early learning and going back to poverty again, social support systems, the less resources you have to draw on from your environment and from your community, the more likely it is that you will be overwhelmed by the stressors that you confront when you have to deal with a big one, right? You are also more likely to develop PTSD the more severe and more prolonged your exposure to the trauma is, right? Somebody who was stuck in New Orleans through the entire several-month horror show that was Hurricane Katrina quite likely had higher levels of exposure and had more severe trauma than someone who, got out before it got bad and came back and their house was gone, right? Not that second situation can't still be really difficult to deal with, but if you're stuck in the mud and in the trouble and in the trauma for longer periods of times, that makes it more likely for you to develop PTSD. The development of psychopathology perspective looks at it as the interaction between genetic predisposition and exposure to trauma. This is what we call epigenetics, the interworking of environment and genetic coding. So it's this perspective says it's not just that something bad happens so you get PTSD. It's that you are born with a particular genetic inheritance, and maybe you inherited a particular predisposition towards high levels of anxiety or high levels of stress reactivity. And then you get exposed to some traumatic event, and that then is what develops into PTSD for you when maybe it doesn't for somebody else because they don't have that predisposition, right? That helps us understand why some folks get PTSD and other folks don't. Really, when you're talking about the development of any disorder, you've got to remember the principles of both multifinality and equifinality. Multifinality means that you can have a single event lead to multiple outcomes, right? So a bunch of different people go through Hurricane Katrina. Some subset of them develop PTSD. Some subset of them do not. Some small subset of them actually then thrive even more than they were before based on their exposure to that horrific event, right? You get multiple outcomes based on a single event. That's multifinality. At the same time, you have the principle of equifinality, meaning that you can have multiple causes leading to the same outcome. So one person gets stuck in Hurricane Katrina, develops PTSD. Another person has an abusive father, ends up with PTSD. Another person has to deal with a sexual assault and develops PTSD. Different causes, same outcome. And this is difficult. It makes it difficult to really nail down exactly what is going to cause PTSD for one person and not for another, or any disorder for that matter, because you're dealing with multiple factors and multiple possible outcomes. So, in terms of how we treat PTSD, sometimes, for about half of the cases, the symptoms get better on their own over the course of about 6 months or so. The other half needs treatment, and you can seek treatment even if your symptoms are getting better on their own. That you want them to get as best as they can, right? You want them to go away entirely, if that's possible. So generally speaking, when we're dealing with treatment for stress disorders, what we want is to reduce the levels of stress reactions, learn to think about that traumatic event in a different way, and be able to live a little bit more comfortably without such high levels of stress. How do we do this? Well, frequently antidepressant drugs help with some of that stress reactivity. That tends to work best in combination with cognitive behavioral therapy, where you are helping people process their cognitions, right? We talked about irrational beliefs and irrational thoughts and trying to replace those with more useful ones. Being mindful of how you are feeling and what is going on in your mind. A lot of times we just sort of do things and don't stop to think about them, don't observe ourselves behaving. Learning to be mindful and be in the moment with whatever it is that you are experiencing can help reduce the levels of stress involved. And there are some newer therapies, EMDR, where you essentially, these are exposure techniques where you're getting the person intentionally to think back through their trauma, and then either walking them through relaxation techniques or these eye movement desensitization, where you are retraining the brain essentially to think about these events in a different way than you did before, in a more positive way, so that they don't cause you such terrible stress reactions. And of course, there are, depending on the situation, group therapy or family therapy may be the better way to go if you are dealing with trauma that is intimately linked to other people that live with you all of the time. Probably getting them there in the room too, depending on the situation, may be a good idea. We continue to innovate here. There's a lot of work, especially with combat vets, where rather than having them do imagine things in their mind to relive the event, we've started to incorporate virtual reality technology, so that you can actually be literally seeing the thing that is causing you stress and choose your own responses to it in a very sort of video game kind of way. But it's probably not going to look like your standard first-person shooter. It's going to be a scenario that allows the person to recontextualize that experience and learn to think about it in a different way.